And we're going to be talking today about the Cuboid Subluxation Syndrome. This is a very common injury amongst runners, especially overuse and origin. We're going to look again today at one of the diagrams just to make sure that everyone understands what's going on with this injury, make sure they understand what type of treatment is going to be best for them. Again, lateral cuboid syndrome, it is very common amongst runners and jumpers and people who use their legs a lot. There's ligaments and tendons that go and attach to the cuboid, so it's something very important to consider, especially when treating the problem. I'm going to show you on a model right here to make sure that everyone knows exactly what we're talking about. So it's important to get your orientation first here. What we're looking at here is, here's the foot, here's the outside part of the foot, here's the big toe right here. Okay, so we're looking at, if you go all the way down the outside part of your foot, you see this bone right here, the one that sticks out. That's called the styloid process of the metatarsal right here. The next one is it's called the cuboid. The cuboid, it just sits between the calcaneus and the metatarsal right there, and basically there's two joints between. So you're going to see there's one here as well, so it is very important, and there should be lots of motion between these joints. However, a lot of times movement is restricted in certain directions from whatever external forces they might be. There is a concern is really the ligaments that go in and around this cuboid, also on the bottom, and also the tendons that pass by it as well. It's commonly thought that with lateral or with the cuboid syndrome, it tends to actually move upward this way from chronic external forces that are really just pushing it this direction. So those forces can cause irritation to the joints here and also up here, so it can cause a lot of problems. One common thought is actually that there's a tendon just below it. It's called the peroneus longus, or the fibularis longus tendon. It actually kind of resides right where my finger's at. It actually the muscle starts way up here around the outside part of the knee. So here's the outside. It attaches right around here, goes all the way down the side of the fibula, and actually comes behind the lateral malleolus, comes this way and underneath to the part of the foot. So it's common for people who have repetitive use types of injuries on this part of the ankle, on the peronei, to have this tendon to kind of increase in tension and also also causes an external force and start pushing this the cuboid superior or upward. Really what you have trauma to the ligaments surrounding the cuboid, as well as the joints there as well, because of those external forces, and I tend to think it's actually because of the increased tension along the peronei, the peroneus longus tendon. So what would treatment entail for something like this? Treatment to these areas, we should be looking at mobilization or manipulation of that cuboid joint, as well as treatment to the surrounding soft tissues such as the tendons, ligaments, and musculature that really encompass that joint as well. For treatment of the soft tissues, I really recommend someone who's experienced with deep tissue therapy or manual therapy. Active release is a great option out there, or grafting is good as well. Those people are usually they're very good with working with their hands in the soft tissue, so that's a good shot for you. But overall, you should be able to find some significant relief, at least within 4, 5, 6 sessions, with a lot of different types of treatments out there. So if you're not finding that type of relief, I'd really recommend that you go find maybe different options for yourself.